Ready? Good afternoon and welcome to our COVID-19 update presentation for November 12th. We're going to have to mute that. I just want to thank everyone for joining us here today. We're going back old style. What's old is new again, as we, due to the increase in cases with regards to COVID-19 and the demand for participation in this conference, we are going back to a WebEx delivery in which the media will be calling in with questions. Once again, I'm Eric.
You gotta mute yourself by hitting *6.
You're unmuted.
Are we okay? Can you hear me now? I guess there was a slight issue there, but we are coming to you live from the Rath Building for our November 12th, 2020 presentation with regard to COVID-19. I am joined by Dr. Gail Burstein, who you hear from shortly, as well as Kendra Schmidt from Deaf Access Services. What's old is new again, as we are going back to a virtual presentation with the media in which they'll be calling in from various locations across the community, as unfortunately we have had an increase in COVID-19 with a very, very rapid infection rate across the community. So we are trying to limit the number of individuals in this room. There are right now 6 individuals in this room, 2 that are manning the controls, myself, Dr. Burstein, Kendra, and I want to thank Woody from Channel 4, who's here providing a pull camera for the rest of our media across this community. We're doing this because we are very concerned about the growth of COVID-19 in our community, and we want to present facts and information to the public without potential exposures from other individuals. So going straight into the data, there are, as of the close of business yesterday, 16,130 total positive cases that have occurred in Erie County. These are 16,130 separate individuals, not repeats, out of 600,440 specimens tested. As of November 9th, 736 individuals have died from COVID-19 in Erie County, and we offer our deepest condolences to those who've lost a loved one as a result of COVID-19. There are, of course, no presumed positive cases. All these individuals had a positive test prior to death. On November 10th, with regards to hospitalizations, there were 126 individuals admitted to Western New York hospitals for COVID-19, 84 of them in Erie County. This is the highest number the Erie County's had since June 10th. 17 Erie County patients were in the ICU and 7 had an airway assist. You can see on the screen right now the hospitalization number for Western New York and 126 COVID patients in all Western New York hospitals, which includes Erie, Niagara, Chautauqua, Cattaraugus, and Allegheny counties. It does not include Orleans, Wyoming, and Genesee counties, which are included in the Finger Lakes region. And of those 126 patients, 21 were in the ICU. And you see in the last week to 10 days the dramatic increase in cases. We are now up to 84 as of the close of business on November 10th. And there's basically been a doubling, more than doubling actually, in the past week and a half. Given the significant increase in our new daily cases, we do expect our hospitalization numbers to increase. We are glad to see the ICU numbers are not necessarily increasing, but if you look at that bottom line on the graph, that is deaths in hospitals for COVID-19 patients, we have had a number of deaths in the past week, and once again we offer our deepest condolences to the loved ones of those who may have perished as a result of COVID-19 in the most recent period, and of course since it started in March. The diagnostic tests and positivity rates tell a very succinct story. Approximately this time last month, we were at an average rate of 1.5% positive for all the tests that were performed that week, and we've jumped up from that to 4.6% positive as of November 7th, for a total of 2.1% throughout the whole process. But we are very worried over this last 6 weeks as we've seen this rapid growth in the last 2 weeks. And this week's total, which of course we won't release until next week, has already surpassed last week's total of 1,520 cases. So we know that more than 1,520 individuals have tested positive just on November 8th, 9th, 10th, and 11th, which is more than the prior week. And we do know that our infection rate has gone up to where the last 2 days it was over 7%. And it is rapid growth across the community. This I hope you have an opportunity to look at. It is a chart which identifies infection rates by zip code. New cases are everywhere. This is as of November 7th, for the week of November 7th, just the week of November 7th. The top zip codes in gray are smaller areas that did not have a huge sample size. So some of those numbers are very, very large, but they didn't test a whole lot of individuals. The areas below that, you will see that there were hundreds of individuals, unless it's a very small area, that were tested on a weekly basis. And some of the infection rates are as large in those areas as 11% plus, such as 14228 zip code in the town of Amherst, which tested at 11.4% for the week. There were 75 new cases that week, of which we know 30 appear to be individuals who live in off-campus housing around the University of Buffalo. They're students, they may not go to UB, they may go to one of the other schools, but we know that 30 of those cases alone were off-campus housing. But you look at some of the other numbers here, and one of the largest also is the town of Elma, which tested at 9.6%. And there were 27 new cases that week in the town of Elma. There were 22 new cases in the town of Evans. Springville had an infection rate of 8.8%. There were only 17 new cases, but it was high. One of the interesting things we'll note, these are all the zip codes that tested above 4.0. So this is not all the zip codes, just the ones that tested above 4.0. Well, it's not necessarily easy to see. You can pull this off our website. We are streaming this live on YouTube right now. You can also download it at my Mark Polencar's Twitter page. And what I want people to understand is it's everywhere. It's in the urban settings, it's in the suburban settings, in the rural settings. And if you look at this list, you will note some of the highest numbers are outside of the city of Buffalo. It's the suburbs and the rural areas that in some ways are even worse than the city of Buffalo, though the city of Buffalo is not good. University District, 14214, 5.9%. Elmwood Village, 14222, including the area around Buff State, 5.9%. Buffalo North, 5.5%. So when I say Buffalo is not doing as bad as the suburbs and the rural areas, it's because some of the suburbs and rural areas are horrible with infection rates that are above 8% or greater. And this is last week's data. This does not include data from the 8th, 9th, 10th, and 11th. And as we noted, the last 2 days, the infection rate countywide has been over 7%. So we expect these numbers to be higher across the board. And that's one of the prime reasons why the vast majority of Erie County is in a yellow zone. It's possible that other portions of Erie County could be put in a yellow zone based on this data, which would basically have to take the whole county with regards to some of the rural areas that are not in the yellow zone, but could be. And so we want people to understand cases are everywhere. It doesn't matter where you live. New cases are cropping up in the suburbs and the rural sections as well as the city. I'm going to turn this over to Dr. Burstein to talk a lot more about cases and issues, including some modeling that we have from Dr. Peter Winkelstein and his team at the University of Buffalo regarding hospital census. We're happy that our hospitals are not inundated, but we do know that they are getting a little tighter when they include their elective surgery patients, including a couple of hospitals that have less than 10% occupancy available in their overall beds, though ICU beds are better. But this modeling talks about the issues associated if we don't take this seriously, how we will see exponential growth in cases in our hospital census. So Dr. Burstein, and let me put my mask on before you come back up here. There you go.
Thank you. Good afternoon. So as the county executive mentioned, the slide that we have up right now is a slide given to us by Dr. Peter Winkelstein at the Jacobs School of Medicine. He is looking at modeling studies to predict the census of Erie County hospitals. So let me walk you through what this slide means. So this is looking at the predicted hospital admissions based on Dr. Winkelstein's model in the yellow line, and the actual hospital admissions in the line composed of blue dots over time, starting from the beginning of our pandemic in Erie County in March, going through the summer where we had everything shutting down, then going up through the phases, phase 1, phase 2, phase 3, phase 4, and then finally in September when schools open. And then now you can see we're at the end of the blue line and where that is going. So the yellow line has several different routes. And so there is the higher line, the higher slope line, is what we would predict would happen if people continue to let down their guard. They're going out in large crowds, people not masking, people not physical distancing, people gathering for holiday parties, for Thanksgiving get-togethers, going out to bars Wednesday night, the night before Thanksgiving, and seeing their friends. That is the slope that we will see in the hospitals, and you can see an exponential increase in hospital admissions. However, where you could see where we would be on the bottom slope line that is almost flat is where we will be with hospital admissions if we go back to being really tight about staying away from large gatherings, wearing masks when we're around other people, physically distancing. If we're getting together, be outdoors instead of indoors, staying away from gatherings, not going out to restaurants in large groups, not going out to bars, not going out to big indoor sporting facilities, and hunker down like we were able to do in the spring and the summer, and that is the line of hospital admissions that we would expect to see. So unfortunately, where we are now is, again, with the blue dotted line, and you can see that the hospital admissions are exponentially increasing. And instead of the line that we had been following, which is in the middle road, the middle line, we are quickly inching our way up to the steep slope where we're going to see an exponential explosion of hospital admissions if we don't take action now. So let me talk to you about what is going on with the increased number of cases with contact tracing and isolation and quarantine. So as the county executive mentioned, we have just had an explosion of cases this week in Erie County. And given the high volume of cases, our contact tracers are a little bit behind. They're a couple days behind in terms of their investigation. So if you've been contacted by your healthcare provider, because you will be informed of your test results by the ordering physician before the county contacts you, there'll be a couple days lag. So given that, knowing what to expect, if you receive a positive test result, isolate. You know what to do, so isolate. So you should stay in your home, stay in your own room, don't go near anybody else for either 10 days from the onset of symptoms if you had symptoms, or 10 days from when you had your specimen collected from the test, if you don't have any symptoms. And then let all your close contacts know, everybody in your house, people that you work closely with, your BFFs, your friends that you may have been close to for within 6 feet for more than 10 minutes, that they are close contacts and that they should be in quarantine. So everybody who has been notified that they are a close contact to a case, and they should put themselves in quarantine. Because again, there is going to be a time lag before the contact tracers will be able to get to you. So if you have worked closely with somebody who told you that they were a case, or if you live with somebody, or a good friend of yours said, hey, you know what, I just tested positive for COVID-19, I just found out, please quarantine yourself. So that means, again, it's the same thing in isolation, it just means you don't have a positive test yet. So stay in your own room, stay in your own house, don't go out. Nobody can go shopping, nobody can run errands, nobody can go outside for walks with friends. Everybody has to hunker down, and this is how we break the chain of transmission, or else our rates are going to continue to escalate and exponentially. So if you have questions about isolation and quarantine, and that's fair because it's a different concept for a lot of people. Most people haven't done it before. We have a lot of great information on our Erie County Health Department COVID-19 website. There's actually a specific tab that has the isolation orders, have the quarantine orders. It has FAQs about isolation and quarantine. Also, your healthcare provider is a great resource to answer questions. All the healthcare providers in our community are familiar with these concepts. They know what to do, and so they can help educate you if you have questions. We do have our hotline at 858-2929. I'm going to talk about that in a minute, but that's a little overwhelmed right now with people requesting tests. So really, be informed, be smart. Go to our website, look at the FAQs. Put yourself in isolation if you have received a positive test result from your healthcare provider, and put yourself in quarantine if you've been told that you have been exposed to COVID-19. It is the only way we are going to get out of this mess. So I just want to reach out to Erie County residents. Stay at home. If you are sick or you're waiting for your COVID test results, do not go to work, do not go to school, just stay at home. And if you're an employer and one of your employees says, hey, I've been told that I've been a close contact, somebody tested positive that's a friend of mine or somebody I live with, but they haven't been contacted by a contact tracer, please give them the benefit of the doubt. Again, we're a couple days behind, we're hiring more people, we're working the systems, we're changing our systems to be more nimble, to be able to get out to more cases. We still, with all these numbers, we're a couple days behind. So please, employers, if your employees call you and tell that they're in quarantine or in isolation, believe them, cut them a break. So in the meantime, people who are not in isolation or quarantine, there's still a lot that we can all do to bring our numbers down again. Remember, we did it once, we can do it again. Everybody can wear a mask. Very important. The mask will help not only protect you, even more important, it'll protect other people if you have an asymptomatic infection. Wash your hands frequently. You can't wash your hands enough. Your hands should feel like they're going to fall off from all the washing and hand sanitizing that you're doing. Maintain as much physical distancing as you can. And even more important, stay away from crowds. Don't be in a room with a lot of people. Even if you can physically distance in a room with a lot of people, you're still at risk. The more people in the room, the more at risk you are of being exposed to somebody with COVID-19. So stay away from large gatherings. And that could include any type of sporting facilities, it could include any type of parties, and it can include any type of gatherings, but it can include going out to restaurants or to bar, especially bars. We're seeing, unfortunately, some bars where they're still having too big a crowd. So please, it's just stay at home, hunker down. We have to go back to what we were doing in the spring because that worked. We know what works, and we have to start doing that again. So, because of all the demand in testing and all the cases and all the people in our community and symptomatic, and the more cases means there's more close contacts that need testing, we've had to change around our Erie County testing criteria for COVID-19 testing. So right now, we are testing Erie County residents only who are either close contacts to confirmed cases, so people who are under quarantine, whether they have symptoms or not, or if somebody who is not a close contact and they do have symptoms, then we will be able to schedule a test. So so you can call our number 716-858-2929 to schedule. Remember, these are by appointment only. We're no longer giving any special clinic hours for rapid testing. to school staff or students. We have so many people in the community. We really have to reach out to everybody in the community, not just those involved in pre-K to grades 12. So we're opening this up to everybody who's symptomatic in the community. So our phone lines are, if you've tried to call, I'm sure you see that they're really overwhelmed. We're doing things to change it up, increasing the queue, hopefully getting a couple more phone lines to get through. However, you may not be able to get through. So if that is the case, we have a map on our Erie County website, our COVID-19 test sites map, where it has information of hopefully all, if not all, almost all, of the sites in Erie County that are offering COVID-19 testing. You know, we are so fortunate in Erie County that we have so much access to COVID-19 testing. Not just the county, the urgent care centers are all testing, many healthcare providers' offices are testing, pharmacies are testing. The New York State Health Department has a great testing site with long hours and hours on the weekend, and that's also free, and you don't need a healthcare provider's any type of order. So there are options, other options in Erie County, and so people feel they need to get tested and you can't reach us. We want you to get tested, so please go to our map and find a place where it's best for you to get tested, because it is important. Because that is the way we identify infections, put people in isolation who are positive, put their close contacts in quarantine, to break the chain of community transmission. So there is still a travel advisory for New York State residents. So the Erie County Department of Health is strongly discouraging people from traveling to states that have high rates of COVID-19 transmission, which is basically almost every state outside of New York State. So please, if you're going to travel, think twice. Even if it's for 24 hours, even if it's a contiguous state, there are high rates, high numbers in those states. And the numbers are high because they're engaging in large social gatherings with sports, parties, restaurants, shopping. People aren't masking. People aren't physical distancing. So you're really putting yourself at risk, no matter if it's a contiguous state or if it's 24 hours, if it's less than 24 hours, you're still putting yourself and your family and the people you come back to at risk. So please, stay home, Erie County residents. New York State is getting a new opt-out of quarantine, a get-out-of-jail option for people who do travel out of state. And that is on the state's website, that formula. So basically, if people are traveling over 24 hours and they are not essential workers, they need to have a test within 3 days before returning to New York State. So that's the first test. You don't need the results before you return. However, you do need to have a test taken. And then you return, you quarantine at home for 3 days. Then on the 4th day, you can get a second test. And if both those tests are negative, then you can go and release yourself from quarantine. So there are a little bit different rules for people who are essential workers, a little bit different rules for people who are in another state for less than 24 hours. But however, regardless, there are still risks for everybody that travels out of state. And I'm going to turn this over to the county executive.
Thank you, Dr. B. I think we all know that we have the microcluster strategy, the yellow zone, which we've talked about for a few days now, as announced by the governor, which includes everywhere from the northern part of Erie County, except for the town of Newstead, all the eastern edge suburbs, and then goes down to Hamburg, Orchard Park, and the town of Aurora, everywhere in between. For the time being, we will be in yellow. There was a rumor today that the governor was going to announce we're going to orange. I have no proof of that, and I talked to the governor's staff about a half hour before we went on television, and they said they are not aware of any announcement being made, so whatever rumor was out there was false. We do know the rules associated with New York State now and the microcluster zones, which we're really a macro cluster. We're not micro. This is 2/3 of the geographic size of the county and roughly 80% of the population. But throughout all of New York State, including the entire viewing area, all restaurants, bars, and gyms must close at 10 p.m. Indoor and outdoor gatherings are limited to more than 10 people. That's across all of New York State. The governor's treating everyone the same. In the yellow clusters where we are here, bars and restaurants must have no more than 4 people per table. And then, of course, schools must test 20% of the total staff or students to maintain in-person learning. I want people to understand there would literally thousands and thousands of combined tests that have to be done on a weekly basis. There are some districts where they actually are required to test more students and staff combined than what we've basically been doing on a weekly basis for Erie County because of the size of their student population of their district. Schools have received information on how to order COVID-19 diagnostic test kits from the New York State Department of Health. We've heard some things that saying schools don't know how to do it. They were provided guidance in October if they were in a yellow, orange, or basically yellow zone, because in orange and red, you have to go 100% virtual. And it's my understanding they were just shared the guidance again from New York State. And schools are responsible for establishing a testing program and reporting those results to the County Department of Health. We then have to provide them to the state. These standards are set by New York State, not the Erie County Department of Health, and they apply across the state. There are lots of cluster zones in New York State right now. It's not just a couple. There are lots of them, from downstate to Westchester County, through the Hudson Valley, the southern tier, central New York, and of course here in western New York and Erie County. So I don't want people to think the governor's just picking on Erie County. It's everywhere, folks. And we are probably lucky that we did not end up initially in the orange or red. There are some zip codes that potentially could have been, but we know the transmission is everywhere and the problems are everywhere, so we're in the yellow right now, and we're hoping we can avoid the orange and red. Wanted to give an update on county's personal protective equipment inventory. We spent a good portion of the summer and early fall acquiring PPE just for this time and the situation should it arise, that we had enough for not only a county workforce when we're doing clinics and other things, but also our partners if they should run low, like hospitals and nursing homes. We have, as of November 6th, over 5.5 million nitrile gloves of all sizes. We have 331,000 vinyl gloves. We have over 700,000 cloth masks. We have over 11 million procedural masks in stock at our 2 warehouses. We've doubled our warehouse capacity. It was 1, now it's 2. The gold standard for masks are the Moldex or 3M N95s. They're still very difficult to get. We have 89,000 of those in stock. We also have different N95 masks. They're called the Macrete. All sizes combined, it's a little less than 3 million. We also have the KN95. We have a little less than 200,000 of those. Goggles, over 117,000. Face shields, approximately 180,000. And swab testing kits. We've had a lot of questions about testing kits. We have over 350,000 combined swab testing kits in our inventory at our warehouses. So we have a very healthy stock of PPE. But if things went really bad for a long time period, this could get used up. I feel comfortable. We're in a good position right now. I think you see the numbers. It's very large, especially considering what we saw earlier. But we're in a pretty good position with regards to PPE. Holiday gatherings. We are advising the public to limit holiday gatherings, starting with at least Thanksgiving, to only your household. We know the same advisory was made by Allegheny County due to the rapid increases in deaths they saw there. We are advising and recommending the same thing. Limit your gatherings for Thanksgiving to your immediate family. Do not travel. Don't invite visitors from outside the area, for that matter, truthfully outside your home here. You put them at risk, they put you at risk. We do need to continue to turn the tide before this spirals out of control. We do not like what we're seeing. We think it is still salvageable. We think we can bring this down, but it requires all of us. Too many people like to talk about me. Too many people like to talk about I. You're infringing on my rights. I have a constitutional right to do whatever I want. We have to think about we. We are all in this together. We need to protect our community members, including those that are at higher risk for COVID-19 complications, including death. We need to think about we, not me. Otherwise, there will be some ugly shutdowns coming forth. We did announce this weekend a new program, the Back to Business Shop 716 program, where you can get gift cards. You can buy them online. You can even use them online at local shops. We want people to shop local. We don't want you to shop with the national and the international online retailers. We want to support our local retail community. So if you go to our Back to Business program, and actually at the Amherst Chamber of Commerce, amherst.org/shop716, you can find more information about it, including if you buy a $25 gift card, you will receive a free $25 gift card as well, courtesy of Erie County, to shop local. So go once again to amherst.org/shop716 to purchase your gift card online. You don't have to go anywhere else to purchase it. And then for some of the retailers, you can use it online. Others would be used in person. We still want people to go out shopping, but you got to do it smart. Got to wear your masks. Got to do the right things so that we protect our general public. And with that, I would just like to finish up by saying this is a very, very tenuous time. We are on the edge of some terrible, terrible numbers if we do not get this under control. We see what's happening in other parts of the country. El Paso is storing bodies in mobile morgues, basically. Wisconsin, other areas are in horrible shape. I was talking with some of my fellow county executives yesterday on a late night conference call, and Dow Constantine, who's my colleague from Seattle, Washington, King County, Washington, said they've been able to control their own numbers, but their own hospitalizations are starting to go very high because they're getting people from Idaho and Montana that their hospitals can no longer handle because they have so many patients. We do not want to become like Idaho and Montana. We do not want to become like El Paso or Wisconsin. We have an opportunity to control the spread of the coronavirus, but we have to do it together. It is we, it is all of us, being our brothers and sisters' keeper. Please follow the rules, wear a mask, wash your hands, limit your activity outside of your general home if possible. If you are an employer and an employee calls and says, "I'm sick," do not demand that they come in. Tell them that they can get a test if they have the symptoms of COVID-19 through Erie County. To people out there watching and listening, if you're sick, don't go to school. Don't go to work. Stay home. We're seeing and hearing of case after case of people who knew they were sick and still went to work. We're hearing case after case of individuals who knew they were sick and still went out and partied with their friends. We know of one situation where there was a party limo bus in which an individual was sick and then partied for a few hours on a limo bus. And it's basically caused the shutdown of that employer, at least in-person learning, because it's a school district, folks. This is serious. We need to do a better job as a community to protect our fellow community members. So with that, I'm going to open up the phone lines to take questions from members of the media, and I do want to thank Kendra once again for being here. So if you guys can open up the phone lines, and then I will call everybody in order based on my sheet here. Remember to unmute yourself, our friends of the media. You need to hit *6. So we will start with AP, Albany or Buffalo. Let me turn up the volume. Anybody, AP? I know we have Ethan Powers from B News. Ethan, would you go ahead?
Hey, Mark. In regard to how some of these new state restrictions are going to be enforced, specifically the limiting of private indoor gatherings to 10 people, you had mentioned in your remarks there, with the holidays on the horizon, the recommendation from the county is to keep it limited to those within the house. But inevitably, families are going to gather. What's the level of enforcement that residents should expect to see? Are people at risk of incurring fines on Thanksgiving if they should hold a large family gathering?
Well, when it comes to that question, Ethan, we know if everybody in Erie County decided they were going to have a large gathering, it would be pretty near impossible for us to be able to police that. What we're trying to do is ask for people to do what's in the best interest of the greater community. If you're out in the public and you have a large gathering, you can be and will be fined. Police departments are involved. The state is bringing in more of its inspectors from various parties, or I should say divisions. State Liquor Authority is bringing in more inspectors. State Agri Department is doing it, as well as the New York State Department of Taxation and Finance, which will be assisting. So I'm just asking people to be on their best behavior. I know we've had problems with Bills games, not people in the stadium, of course, but people attending parties. And we've had confirmed cases of individuals that attended a party for a Bills game at somebody's house. Oops. So, the joys of technology. So we're just asking people that they be on their best behavior and follow the rules so that we can get through this. Otherwise, we could end up in a shutdown like we were in the spring, and nobody wants to deal with that. Next question goes to, is anybody on from Buffalo Business First? If not, Buffalo News, Sandra Tan and Aaron Bessaker.
I wanted to follow up on the enforcement question. I know other places, I think Connecticut called it the honor system. I mean, is the sheriff's office going to get involved here? I mean, are people supposed to? Are you expecting people to call and turn in their neighbors? Or how is this really going to work at such a in terms of enforcing this particular requirement?
Well, based on what we saw in the past, I fully expect people to call our hotline, because we have had people call our hotline before. It's also up to the local law enforcement, not just the sheriffs, every town, every city, every village to enforce this. So every local law enforcement, as well as those state agencies we talked about, can be involved in local law enforcement. Any other questions? Sandra, do you have a question?
Yes, I did. Thank you. Local health experts seem to believe that there's a high likelihood that, given the numbers that we're seeing, it's just a matter of time before we move forward into an orange or red zone. And I'm wondering, if that happens, do you have any sense as to how that would occur? Would the entire yellow region move forward to orange or red, or could it be just some pockets? And what is your own sense as far as how close we are to moving into one of the higher zones?
Well, I can't give you a definitive thing with regards to how close we are to moving into a higher zone. It's going to be revisited on a weekly basis. And if the state decided that it's so bad, they could do it tomorrow if they so chose. They could do it tonight. And there are some areas that are pretty bad. I can't give you a definitive time, but we don't like what we're seeing, and we're hopeful that we can stem the tide. As I said when we discussed this earlier this week, when the yellow zone was announced, there are some portions in the yellow zone that could have gone to orange and possibly even red. The problem is it's all over the place. It's not just like one zip code or one neighborhood. We have, as I showed on the screen earlier with regards to the infection rates, we have some very high infection rates across the whole county. So I know you want a definitive answer to that, Sandra. I can't give you a definitive answer, but Dr. Burstein, our health department, just like I am and the rest of the medical community, are very concerned about the direction we're heading, and if we do not control it, we're headed for a very bad rest of the fall.
So if we did move forward, you don't have a sense as to whether or not the whole yellow region would move forward altogether if that ended up happening?
I do not know.
Okay.
And as I said, there's possibilities that areas that aren't in the yellow could be put in the yellow, or for that matter, orange. It is quite possible. Investigative Post, is anyone on? Spectrum Buffalo, Ron Haney. Spectrum, if you're still on, unmute your phone, *6. If not, we'll move on to WBEN, Mike Baggerman. Just make sure your phone's on.
Hi, Mark, can you hear me?
Yeah, I can hear you.
Okay, I wanted to ask you about the testing supplies in Erie County. The number that you had up on your graph earlier was 350,000. With Erie County's announcement that they're limiting testing to those under quarantine or those who are symptomatic, I mean, doesn't that basically assure that the positive rate is only going to be increasing throughout Erie County? And can you also speak on the testing shortage and what's being done?
Well, we have testing swab kits of over 350,000, but we actually still have issues with regards to the test kits for the rapid test kits, the Abbott ID Now, as well as the reagents we receive from the CDC. We are constantly getting a 2-week supply from the CDC on the reagents. We feel pretty good about that. The test kits with regards to the Abbott ID Now, we were less than 1,000 earlier this week. We're expecting more to come in, but not enough to handle everything we want. Swab kits, we have a lot of swab kits. The argument that we are going to have higher positives because we're testing those that are symptomatic or those that are close contacts is false, because that's what we've been doing all along. And oh, by the way, we've been averaging 1,300 tests a week for the county, but we've been doing as a community 30,000 or more on average per week, or high 20s. So there's all these other agencies out there. It's not just Erie County that does the testing. The people who are coming up with that narrative, it's a false narrative, because we're less than, as you can see, with 30,000 tests, we're less than 10% of all the tests. We're basically less than 5% of the tests that are being performed in Erie County. So just by saying we're limiting it to symptomatic individuals, we were doing that with the Abbott ID Now anyway. We were not testing asymptomatic individuals with the Abbott ID Now rapid tests. We were testing solely symptomatic children and adults that worked in schools. Now we're just going straight up symptomatic individuals and those with a close contact. We're concerned because this growth is very high. It's being seen by all the testing labs. It's not like it's just Erie County's lab that's identifying it. All the testing labs are seeing it. New York State's labs, the private labs. So just by reducing a small portion of the county's overall test capability as compared to the total capability doesn't mean that it's automatically going to shoot the positivity rate up. And there was one argument that was being made is, oh, the positivity rate's going up because you changed the protocol for testing. The testing protocol does not go in effect to change until today. So all these recent tests from the last 2 weeks, that was testing everyone. So it's not because we changed the protocol did those numbers go up. They went up because people are not following the rules. They are not being safe, and they're catching the coronavirus. WBFO, Mike Desmond. Just make sure you're *6, Michael, to unmute your phone.
Okay. Yeah, there we go.
We are in WBFO hell. Try that again. Are you there, Michael?
He's gonna have to turn his speaker down.
You have to turn your speaker down, Michael. The joys of the past are reoccurring right now. Well, we figured that one out. Well, WBLK, anyone on from WBLK? WGRZ, we have Kelly Dudzig and Franco Arditi. WGRZ?
Hi, it's Kelly. Can you hear me?
Yes.
All right. So with the schools, we've heard from a bunch of districts, they're concerned about the supply and also the cost. And then Dave McKinley mentioned that in Monroe County is coordinating everything for the schools there. So is Erie County able to help the schools? Kind of just explain that for parents and whether the schools are even allowed to do testing on site. I know Niagara Falls City Schools are going to be able to do that soon.
Yeah, yes. I talked to Adam Bello, the Monroe County executive, today, and he said they are not coordinating. The state is the one that's providing the tests. The state has said to all of the school districts, we will provide you the Binax rapid test. It's a fairly easy one to do. It requires a small nasal swab, not the usual one that goes deep into the nasal cavity. It is a little different test. The state is willing to provide that for free. So any school districts that's complaining about the costs associated with the testing kits, they've not paid attention to the protocols that New York State has talked about, which is they will provide them the test for free. So other than the cost associated with having the nurse or a doctor there to administer it, they're really, and they have those already on staff, at least nurses, and they have a chief medical officer for every school district. So any school district, if a superintendent is out there saying this is going to cost us millions of dollars, there should be no cost associated with the tests. And I want to remind everybody, earlier this year, Erie County provided more than $15 million to the school districts in Erie County to assist with costs, which also was to be used potentially for the costs associated with testing. So I had a few school districts that are like, we're mad at Erie County. Well, Erie County provided some of these districts millions and hundreds of thousands of dollars to assist them, potentially for costs associated with testing in the future. I don't know how they spent their money. Hopefully they didn't just plug budget holes, because if they did, shame on those school districts. They shouldn't have. They should have used it for direct costs associated with the response to COVID-19. But no, Adam Bello, the county executive of Monroe County, talked to me today earlier. He did not, he claimed that they're not doing all the testing because they can't. They don't have the testing capability to test all the schools. This is the rules that are set by the state. A lot of school districts think we set the rules. These are the cluster rules that have been in effect for more than a month now. And they didn't change the rules for Erie County. These are the rules in which New York State requires a 20% testing to stay in person, and New York State is providing the testing kits. So there's no cost there. And I'm disappointed because we've expressed this continually to the school district representatives, at least the superintendents. If they're going out there and saying something different, that's not good, because we've told them they're going to get free tests. They have to request the tests from New York State Department of Health. It's as simple as that. WIVB, Chris Horvatis.
Hey, executive. I had a question for the doctor, and obviously, Mark, you can chime in on it too. But I took note of what you said about contact tracers being 48 hours behind. That seems pretty concerning, especially considering the cases go up. So conceivably, I assume as cases continue to increase, that lag will grow more and more. Does the county have enough contact tracers, and what recourse would there be to get more? Is there any option to get more and bring that time down?
It's really one day, because generally the contact tracers will contact the individuals within one day of finding out of the case. It's basically 48 hours now. So it's one additional day. We've hired 10 more contact tracers. We're moving people in county government who have training in contact tracers to be contact tracers to handle this crush of new cases. We're actually doing a lot better than some other areas of New York State in which they are basically throwing up their hands and say we can't keep up. I'm not thrilled that we're one day behind, but normally if you get a positive test, it's usually within 24 hours of the county finding out about the test that you'll hear from the contact tracers. We're now 48 hours. We want people to understand, if you get a positive test from Quest, let's say, and we don't get the report until the third day after you had the positive test, we're going to try to get in touch with you within 48 hours. That means you still might have had 5 days between when you found you were positive and when a contact tracer gets in touch with you, because of how the system works. That's why we're telling people, once you find out you are positive, you have to isolate. If you go to get a test but you haven't gotten your results yet, you still must quarantine. Don't go out and party. Don't go out to work. I'll turn it over to Dr. Burstein to answer a little bit more, but we're behind from where we want to be, but we're not that far behind, and we have hired more people, and we're bringing on more people internally to address this issue. We literally went from having low caseload to a crushing caseload in about a week and a half, and we're addressing it. Doc, would you like to add anything?
Sure. Thanks. So thank you. So as the county executive mentioned that, we are very concerned that we are having this huge surge of cases, as you mentioned, and so we're stepping up. We're hiring more contact tracers. We had 10 new tracers start this week, and we're having more start next week. We're doing an all hands on deck. We're recruiting other people from other departments who have already helped us in the past with contact tracers. We're bringing them back, and they're going to help us. We're also changing some systems now. We have ComCare. We didn't have that before. This, the state's contact tracing system. So we are making changes to be able to step up and meet that demand. We're not there yet, so that's why we're informing all Erie County residents that just because you have not been contacted by a contact tracer doesn't mean that you're safe. Doesn't mean that if you know you have a positive COVID test that you haven't been contacted by a contact tracer to be put put in isolation doesn't mean that you can go outside and do whatever you want. Yeah, please stay at home. And then also, we're relying on our Erie County residents who've been informed that they are positive to, be a contact tracer yourself. Inform your friends, your family members, people in your household, people that you work with, that you tested positive and that they should go and hunker down at home and self-quarantine themselves. Again, they may not hear from the contact tracers for a couple more days, but that doesn't change the situation of who is contagious and how we will spread the infection in the community. So people just have to use common sense, be honest, just stay at home. Please don't transmit infection. And also, again, if you are symptomatic and you're waiting for your test result, or if you are a close contact and you're waiting for your test result, you still need to quarantine, because if I were a betting man, I would bet that there is a good chance that you could be positive. So please, just stay at home. That's the only way we're going to get our infection numbers back down again. Thanks.
I'm sorry, doctor. What's the total overall number of contact tracers right now in the county?
Oops. I think we have about, about 40 or 50, and so we're, it's very dynamic because we're calling back people this week from other parts of the other county departments. So, hopefully by the end of the week we'll have maybe 50 people, but again, it's a dynamic situation. And then next week we'll have more. We're really trying hard to meet the demands.
So has that
Thanks.
number decreased over time? Because I know going a while back, the entirety of the Western New York region had like 500 plus. Obviously, they weren't all in Erie County, but I assume.
Well, the number, Chris, did decrease in the summer when we literally were having contact tracers sitting there doing nothing. So we moved the contact tracers that were in county government back to their jobs in county government. It made no sense to have too many contact tracers and unfortunately have them sit around and do nothing all day, which is what basically was happening with some of them. So most of them were internal in county government. We moved them back to their jobs. We're bringing them back now. I mean, last week at this time we were saying we hope we don't get worse, and it just has exploded in the last few days.
Okay, thank you.
Okay, WKBW, Hannah Bueller.
Yes, hi. I am looking to see if you have an age range for the people who are getting sick. Is there, a huge jump in, younger people? Usually there's a breakdown. I didn't see one. And then you had mentioned that, people who know that they are sick are kind of going out and doing these things, gathering and parties. But what are your contact tracers finding in cases of asymptomatic cases, and how many asymptomatic cases are they seeing, turn positive? I know that was a big concern really when this entire thing started. It seems like we're really talking about people who are knowingly sick, but what is the deal with asymptomatic cases and positive?
With regards to the age ranges, it's everywhere. We don't want people to think it's just young people in their 20s. It's all age ranges. One of the things I showed earlier today was a breakdown of the hospitalizations, and I believe it was 44% of people 64 and under were those hospitalized for COVID. So that means that just because you're younger, there was one in there under the age of 19. So just because you're younger doesn't mean you can't catch it, and it certainly doesn't mean you can't get sick from it. With regards to the asymptomatic, I'd have to turn it over to the doctor. We do know that there are many individuals who are asymptomatic that do test positive when we test them in the last week or so. As we're finding out when we get contact tracing information of someone who's sick, and then they give us the names of the individuals that they were in contact with, we let them know, they test, and some of these people are asymptomatic. They don't have a symptom at all. Others have had minor symptoms, but they don't believe they have COVID. So the problem is often in situations where it's the sick person who goes to the event and gets other people sick. Yes, there are asymptomatic people who could transmit it around. There's no doubt about it. But we are getting multiple reports of individuals who, I know I shouldn't have left my house, I wasn't feeling great, but I went out. And I hung out with my buddies watching the Bills. I guess there was a football game this weekend against the Seahawks because I was here, like a lot of other people were here working to try to address these issues with the rapid growth of COVID. And we know there were lots of parties around in private residences, as well as people going to bars and restaurants. And we're starting to hear now of individuals who I was at a private party this past Sunday, and I got sick. I got tested on Monday or Tuesday, and now I know I got COVID. So everybody who was at that party is potentially at risk, especially if they weren't wearing masks. Doctor, you know about the number on asymptomatic? I don't think we have the exact number to answer that question directly, Hannah.
Yeah, I think it's still about 40%. It's a little bit higher in the younger population.
About 40% was the average from our contact tracers, though it's higher in the younger population.
40% is pretty concerning, don't you think?
Well, yeah, we've said that all along. We've always said people should not underestimate this. Even if you are asymptomatic or have very minor symptoms, you could pass it on to someone who could get very ill from it and or die. And we know that there's a lot of folks who are showing up now with post-illness problems, including there was a recent report regarding a certain percentage of them with psychiatric and psychological issues as a result of this, mental health issues, that people had never had mental health problems or suffering from depression and other mental health issues. So this should not be something that people just think, oh, it's nothing. We know about the deaths, but now we're learning about the after effects that can potentially go on for years for all we know. We don't have a whole lot of time left. I don't know if we'll do a follow-up. I don't know. Did you have a question? Okay, we have a question from our cameraman reporter here from.
Answer the cameraman.
He's more than a cameraman. Photojournalist. Why don't you come up here?
Colleges are going to be letting out in 2 weeks because of all the changes for courses. Kids are going to be coming home from all over the country. What should parents do in the next 2 weeks to prepare for their kids coming home? Should they try and get them in the test schedule? Should the kids be taking the test before they leave that state? What should parents know for the next week and a half when these kids are leaving any one of the 50 states to come home?
Right, so the question is, what do we do in our community where we have all these college students that have been away in colleges, living with other kids, seeing these other colleges, schools that have outbreaks. When they all come back to Western New York, what should families do? Well, I think the most prudent thing to do is, consider them exposed. So if my kids were able to have gone away from school, their schools were all virtual this semester, I would make sure that they quarantine for 2 weeks' time, consider them exposed, and get them a test. Best time to get a test would be about a week after they return. So unfortunately, that would include Thanksgiving dinner, because usually the schools return just a few days or a day before Thanksgiving holiday. So, I think it would be a terrible scenario if young people can return from school, join the family for Thanksgiving dinner, and then it turns out they're positive and exposed everybody else in the family, including grandparents, including parents, and including siblings that would, in pre-K through 12, they're hoping to return back to the classroom. So this can potentially be a super spreader event. Another problem is that, we all know traditionally, the night before Thanksgiving, Wednesday night for Thanksgiving, is when all the kids return from school. They all go out to bars to reunite and party. And, again, that is going to be a potential super spreader event. All these people coming from all these different states, from all these different schools, coming together at close contacts in bars. They're not going to have masks on probably because they'll be drinking alcohol, or going to house parties. If you're a parent, please do not let your kids have a house party during the Thanksgiving holiday. This is potentially very serious. You saw the slide from Dr. Winkelstein of what will happen to our hospital admissions if we do not adhere to our COVID preventive measures. We will spiral up with hospital admissions, and that means we're going to be spiraling up with diagnosed cases. So we really have to hunker down over the holiday. It's going to be different this year. However, we want to survive to the other side of the holiday and the other side of, all reach 2021 healthy and safe. And the only way we're going to do that is, again, hunker down when your child returns from college. Consider them a close contact and put them in quarantine for 2 weeks, and then get them tested.
I want to thank everyone for being here and participating in the call. If you have additional questions, you can forward it on to our staff and with either the health department or my staff, our public information officers, and we'll try to provide you the answers. It is very concerning. This is not a joke. This is not a hoax. COVID-19 is growing in our community at a rate that is worse than what we saw earlier this year. We hopefully can avoid major shutdowns. People are worried about orange and red zones, and rightly so. We're doing our best to avoid going into an orange or red zone. I'm very concerned about the direction we're heading. I've talked to other local leaders and expressed the same to them, and I want people to understand that we have to do better. There is no, well, we need to try. We have to do better. We must do better, and it is a we. It's not a me. It is not an I. This is not an issue where people get to debate whether they think it's appropriate for us to be taking measures to protect the general public. We have to protect the general public. We had more deaths in the last week to 10 days than we had in literally months combined. Hospitalization numbers have doubled. Case rates are skyrocketing, and the infection rate is unfortunately to a point where if it continues to grow much more, it's going to be very difficult to stop the further spread in our community. So please, be smart. Wear a mask. Wash your hands as much as you possibly can think of. Be socially distant as best as you can. Follow the rules. No more than 10 people at an indoor or outdoor gathering. Think twice before you go to a gathering, because you never know who's there. And as we noted, because of the number of people who are asymptomatic, someone who looks healthy could give you COVID-19. And if you have an underlying condition, that could be fatal to you. So please, follow the rules, be a good neighbor, let's do our best. It is our intention to hold these press conferences more than once a week. We'll be going to bi-weekly press conferences on Monday and Thursday. So unless something really bad happens over the next few days, you will not see us until Monday, in which we'll give you an update on Friday, Saturday, and Sunday's information, and then we'll be back again next Thursday. Be well, be safe, everyone, wear a mask, and just remember, if we follow the guidance, if we follow the rules, our entire region will be better for it. Thank you, Kendra Schmidt, for your good work. She's one of the hardest working people in all of Western New York right now. And to all, be safe and well.